We have one online.
Oh.
Oh, you were 6. Yeah, you're 6 with you. It's nice.
Yeah. Okay, I'm gonna call the meeting of the Community and Health Services Standing Committee to order. Thank you. Miranda, can you roll call, please?
Miller. Here. Brewer.
Here.
Kramer.
Here.
Glassberger.
Here.
Harwig.
Here.
Oh, hi, Michelle.
Hi.
McGuire. Barris. Braithwaite.
Here.
Chicker. You have 7 for a quorum.
Okay, thank you. And are we in compliance with open meeting?
Yes, ma'am.
All right. I will need a motion then to approve our 14-point agenda.
I'll make that motion.
Thank you, Ms. Brewer. Have a second? Second by Francis. All those in favor, please say aye. Any opposed? Okay, approval of minutes. Does anybody have any comments or corrections to the minutes from last month? Great, if not, we'll declare those approved and move on to number 6, public comment. Is there anyone from the public here or online who wishes to speak? Great. 7A, HHS Director Administrative Report and Review of Organizational Chart. Trisha.
So we have the October updates in your folder. Just a couple things I want to highlight. One of the things that our behavioral health unit has begun doing is domestic violence assessments. There were 3 done in the last month, and this is something that we are expanding programming to and have let the courts know that this is a service we now provide. Through our ADRC, Medicare open enrollment starts on October 15th. This is a really busy time for the ADRC for the primarily EBS, but also our elder benefit specialist, but also our disability benefit specialist. You know, they'll see between 200 and 300 people during that time frame, so it's a really busy time. So I think she is ready for that. In our public health, we've received our flu vaccines and we've started having clinics. I believe our first school clinic is later this week at Weston, but we will be doing Weston, Ithaca, Richland Center, and St. Mary's schools. So they'll be busy in the next month doing those things. In our children and youth services, they are fully staffed. We had Casey Banker, who used to work here, who has returned. So we're very excited. She's been working in Juneau the last 6 years. So we're very excited that that unit is fully staffed. And as an agency, the only vacancy we have right at this time is a part-time clerical at our front desk. So we're very happy about that. Things seem to be going well. So we're very excited. Any questions on those updates? And then I do have the organizational chart in there. I don't know if anybody had any questions, but on the front cover really is an overview of the entire agency. And then as you go through, it talks about each of the separate units. If you have any questions on that, I can answer them.
Say thank you because it's really helpful for me.
Yeah, good. And then just
I'm actually wondering
Yeah.
if, and I thought this before and then I always forget to ask, if we could get like the most recent copy of the org chart just as a separate, so like, for example, in our folder, Community and Health Services, we have that HHS acronym list, just
Yes.
kind of as a separate. Could we also maybe get the org chart? It's super helpful to like, if I'm wondering who works where or, you know, it's nice and then I'm not looking through. So I don't know.
Yeah, I can work with that
Enough
to get
to
that.
upload it in.
Yeah.
But thank you. I don't see this and all the filled spots. Very excited. Great. Any questions from anyone? Okay. 7B, HHS expenditures report, vouchers and expenditures over 2,000 but less than 10,000.
So these are the expenditures we've had since the last meeting. They've been paid in approved agendas for payment. I reviewed it. A couple of them jump out at me. There's one for Cornerstone. It says Cornerstone for 2,000 over 2196.27. That was some repairs we had done to our HHS vehicle. And then the 32,815 to J-Comp is for the network switches that were approved a while back, and that's all getting reimbursed through ARPA funding. We've paid passages, the first half of the donation that the county makes every year. And way at the bottom, it's Sanofi pasture, those are our vaccines, our flu vaccines for $7,000. Our flu vaccines for this year, so. Otherwise, the purchasing card, nothing really helps on that one. Any questions?
Questions from anyone?
No.
All right. 7C 2024 HHS budget summary and Richland County placement report.
For the budget, we should be at 67% utilization. As you can see, for all the different units, we're about 64% overall. Public health is a little high, but that's because all of these ARPA purchases that we're making run through that particular line. So it's just gonna look like it's spending more, because we didn't, I shouldn't say necessarily, we didn't budget for that. So that's gonna be a little high. Let's see, it is showing a negative core balance, but a few things, clients served is really high, CCS, expenditures are really high, and we're always usually a month behind on that. I try to build that in as anticipated revenue, but I guess that's a guess. But some other things in our budget, we budget WIMPR dollars, we don't get those until December, so that's not in there. Consortium in the past, the capital consortium in the past has not taken out their MOE. That means an effort until the end of the year. This year they took it out at the beginning of the year and haven't reimbursed us as much as was anticipated at this point, but. And then enhanced Medicaid, I haven't seen anything on the enhanced Medicaid that we usually get every year. That's usually about 40,000. So if you add some of those things in, it's going to be tight, but we were fully staffed this year too. So we've had some months where we've been fully staffed. So it's going to be a little bit closer to zero. I don't see any major overages like we've seen in the other years. So because of that. Any questions about the budget? For placement reports. Placement report for the two funds there, again, should be at about 67% utilization. Adult placements, as you can see, well, it's tiny there, but it's been a rough summer, high costs for Winnebago, Mendota, rough summer there, but and then in August we started. There's a placement that we have. It's a CCS placement that we try to pay out of Fund 56 as long as we can. But because there's some wiggle room in Fund 54 right now, some of those expenses have moved there. But even then, the utilization is only at 25% adult placements.
However, it looks like we're well within our budget. Correct. That's the good news.
Yes, yep. So I felt comfortable moving it over there because there's, for utilization is good there. And children's is actually, if you look at Fund 44, then children's actually is only at 61%, so, which is good, so.
Feels like we're doing better overall this year than last year.
One of the things that Brandy and I talked about with the adult placements is we have found that when they go into Winnebago, they're coming out a lot quicker.
Right.
Yeah. So
Is that on your guys' end or is that gonna change there?
I think that's on our end. We've worked really
awesome.
hard to work with Winnebago, make sure that when they're there, they're getting out. That we noticed last year is we had a third of our Winnebago individuals came from our jail. And so at the end of last year, the beginning of this year, we talked with Clay and Devin and sat down and really talked about what can we do to avoid these transfers from the jail to Winnebago, because if they're in jail, they're safe, they're secure, they're in a good environment. And so we haven't, knock on wood, had any from the jail this year, so that's been great. It's been a good partner.
But we're not gonna be criticized for not rendering proper supervision and care, are we?
We're not, no, you know, when we talk with the state and they'll say if they're in jail, that's a safe environment. You know, I think there was one last year that would have needed to go because I think behaviors were pretty out of control. But for the most part, the jail staff can ensure safety and can manage the behaviors.
It's just because people are incarcerated does not mean they lose their rights.
Correct. Yeah. Yes.
Some of them, but not all.
Not all of them, yes.
Well, I just want to say that's really great. I remember you talking about that not long after you came and how you wanted to address some of that. And so, good job.
Thank you.
And the evidence is before us.
Yes, we, every health unit has worked hard.
And hopefully the trend continues to get them in and out really quickly because costs are going up.
Mhm.
Yes.
They just do Winnebago, they just do every year, so.
And there was that, from children's, there was a very high cost placement that aged out, so.
Oh, yeah, because children's typically was trending higher,
Yeah.
wasn't it?
Yeah.
The last few years.
And they still are, and we're working hard to find permanence for some of the kids that we've had in place in a long time.
But you can see in August for regular foster care, there were no regular foster care placements. So that means those kids have found
People ask
permanency.
me all the time, how could the state do better for us? That's an area where we can do better. The Winnebago charges, I mean, those are state institutions, so they expect us to provide goods and services. We are the state. End of that. But we can't do it unless we get proper reimbursement or money up front. We can't take it to do it.
So one of the things that's on the horizon is the legislature directed state DHS, Department of Health Services, to request a waiver to Medicaid, that the state Medicaid would cover 60% of these placements at Winnebago, and then the counties cover the other 40. So they are in the process of writing that waiver. It will be submitted at the end of this year. Their goal is to get it submitted by December. But it sounds like it's gonna take up till like 2026 to get an answer. It sounds like Wisconsin is trying very hard to write the waiver to match what's been approved in other states, so as to not kind of reinvent the wheel or have a huge deep dive into, oh, this is a new concept, how do we respond to that?
Wisconsin has the largest surplus in its history, so. It's to come.
With the foster care, the regular foster care, is that reflective of we don't need to have kids in placement, or we just don't have the foster families for kids in placement?
It's a great question. Right now, I think we've just found permanency for the ones we had.
Yes.
Because I had thought that we were really low on foster care families.
We still do not have any foster care families. We had a
Okay,
couple.
so
that-
none.
None. So we've had a couple that have reached out. One person started the process and then had some personal issues and said, I need to take a break from this. Another one has reached out and offered, interest, but nothing to follow through. So now that that unit is fully staffed, I do hope that they can make a push to get more foster homes. There are a couple of kids that we're looking for, just a regular foster home for them to go to. But we're working with Monroe and Vernon to try to use one of their foster homes.
And then at that point, does that reflect in our budget, or would that then be their county?
Reflects in our.
It still reflects, okay.
The other thing that we had happen this summer is we had 3 kids who were in placement for 4 years, went home. And so the worker did a very nice job. It was a new worker assigned, and she did a very nice job of working really hard with the mom to get her to where she needs to be. She had a trial reunification, which is 3 months with the kids, and it has been successful, and the kids remain in her care. So that's been very good. And that was a $30,000 a month cost. Now, we didn't return them home because of the cost. We returned them home because of the work that mom did. And that's the best place for the kids to be. But that was a really exciting thing for us to see.
Thank you. Any other questions? Anyone? Number 8, approval of contracts.
So, on the sheet, the top two are contracts that were under 10,000 that we got, permission from Administrator Pesh to enter into. The Highland Springs Counseling is going to be through our CCS program and to provide some CCS supervision for our adult family homes when the individual is in CCS, and that is a administrative code mandate, and those funds are reimbursable through the CCS program. And the second one is through the CLTS program, families are given an allocation of funds to use to provide services for their family, and this is an agency that oversees those funds and makes sure the bills get paid. I think we have 3 different agencies that we now work with that provide that service. So those are 2 contracts we have entered into. The other contracts are amendments, and I'll try to go through each of them. Southwest Workforce Development Board, we have to modify that contract as we have 1 additional staff member through there, and it is a CCS service facilitator. Our Driftless Counseling is a CCS provider. They provide services through the CCS program, but they also provide some of the service facilitation. Northwest Counseling and Guidance, the first one on the next page, is our crisis response services that we have provided, and they do provide services when we are not, when we do not have office hours. Next is Roots Residential. Right now we have 2 individuals through our CCS program placed there, and so we have to increase that contract. Red Maple Consulting Services, is one of our CCS providers, as is You Are Enough Counseling. And then the last one is Cooley Region Psychiatric Services, and this is Dr. Trammell, who oversees our clinic and also provides supervision in our CCS, our crisis response program. With CCS, we've really expanded that program this past year. As you noticed in the budget, the amount spent in CCS has gone up. It's a service that is much needed in the community, and I do think that's another reason why some of our placement costs are down, is because we do have that option to provide pretty intensive services to individuals.
Okay, so this will be 2 separate motions, correct?
No,
Top
we
and
should
bottom,
just
or
need-
we can do the whole?
Yeah, we just need a motion to approve all the amendments on the bottom. The
Okay.
top one was approved by Administrator Pesh.
Oh, right, absolutely. Okay,
I'll make that motion.
thank you, Mr. Brewer. Do I have a
I'll
second?
second.
Take your pick, Miranda. We'll go with Michelle. Okay, any other questions or discussion on these?
That was
To approve the amendments on
for
the
the resolution.
So there is a
the
resolution.
amended contracts, yeah, resolution number for the, it's 9/24. Okay. All right, if there's no further discussion, all those in favor, please say aye.
Aye.
Any
Aye.
opposed? Okay, so that was number 9 then, correct? We went over the contracts, then approved. Okay, so now number 10, resolution approving the 2025 to 2027 Richland County Aging Plan. That'll be Roxanne.
So we have been working on our next 3-year aging plan since November of last year. It's a quite long process for counties to do. It is something that's required for us to get our Older Americans Act funding. So every 3 years, we go through this process. We write the entire plan, and then we have to have goals for our different funding sources. So I don't know if anybody had the opportunity to go through it. I'll just review some of the goals with you and just do a real high level real quick so you know what you're approving. So our first program is our Title 3B, and that is we're able to utilize that for some chore service, and then also as a lot of our administrative costs. And so our goal for the next 3 years is that older adults will have access to training and educational opportunities to assist with becoming effective advocates. It's really important that
Just
individuals.
interject, Roxanne,
Yep.
sorry. I think we're on page 10 of the document.
Oh.
If you have it pulled up, the,
Thank you.
it's the that document, which in our folder is 10A. I think we're at like page 10.
Yeah, we are on.
Sorry, Roxanne.
No, that's okay. Thank you. I should have said that.
It's okay.
So one of the things that we ask older adults to do in our community is to advocate for services and for needs within the county and the community. And so we haven't had a real great turnout of individuals that go with us to like advocacy days or take part in reaching out to their senators and representatives. So one of our goals is to improve this over the next 3 years. When we did all of our outreach, so we did like 9 different outreach events within the community. And one thing that we heard is that there's a lack of funding, there's a lack of services. But unfortunately, there's been no changes in the funding over the last really 20 years. So that's where we came up with the goal to do more education surrounding advocacy and trying to get people more involved. So that way they can be involved in what do our services look like going forward in the county. So that is our goal for that. Our next program is our C1, which is our nutrition, and our C2, which the C1 is our congregate meals, and the C2, the next goal after that is our home delivered meals. So we are going to work on one thing that we really heard from the community is we want more fresh fruits and vegetables for our meals. And so we're going to work initially, looks like Rockbridge Meal Site, to create community gardening. And so that will integrate older adults and also children from the Rockbridge School to work on gardening together and then be able to utilize those fruits and vegetables as meal components. So that is our goal over the next 3 years to start that. We'll probably start that in Rockbridge and then look at moving into other communities as well. So we're really excited about that.
Sure. Is that on the grounds of the Rockbridge School?
It will be.
Area?
Yeah, they're actually building
Pastor
raised
Dan
beds.
says that's good.
Yep, we've been already having conversations through this whole process with community members. So yeah, so we're really excited because they're going to build raised beds out there, so it'll be accessible for people. So it's just,
great.
yeah,
Exciting.
yeah,
It's
great
great
opportunity.
that whole complex is really developed into something.
Yeah, and they're very community, involved in the community, and really their big goal right now is that intergenerational.
I mean, that's actually taking building that would be otherwise vacant and an area that would be otherwise abandoned and
Right.
making something out of it, which is it's wonderful. I wish you could come down to the campus.
Do they still have do the older adults still gather there in that same building for the kids? Yeah.
Yeah, so we have our meal site 3 days a week.
And it's,
Here?
he updated the rooms and they're
Yeah.
beautiful now.
Yeah.
New carpeting, new ceilings, new walls.
So since we toured it when they had the initial children's.
Well,
place-
maybe not since.
Well, I
but
think because I don't think they had done a lot of work.
from
Go
3
there and
years
look at it, yeah.
it's Amazing what it's like now.
Yeah, and they just redid their parking lot too, so the parking lot is all redone out there. So yeah, they just continue to do a lot of really great things out there. For our home delivered meal program, we are looking at expanding our deliveries out instead of 5 miles from a meal site to 7 meals from a meal site, and including Rockbridge as doing home delivered meals as well. That area out there really is kind of a food desert. There's, we have the congregate site, but there is no home delivered meals out in that area. So right now, their only option is to have frozen meals. And we're hoping that we can get volunteers from that meal site to do those meal deliveries, and they are completely a volunteer meal site. So there's very little cost going into the Rockbridge meal site. So those are our 2 goals for our nutrition program. Our next goal would be for our health promotion program, which is Title 3D. We have a really great relationship with Simon's Recreation that's been going on for many years, and that's on page 16. And so we just are going to continue to expand on that relationship. When we first started our partnership with Simon's Recreation back in 2012, they did 1 health promotion program for us a year, and it served 8 to 10 people. Now we're doing anywhere from 8 to 10 classes a year. So we've really expanded, and we wouldn't be able to provide those services without some assignments recreation. So we get about $2,600 a year, and we'll be able to do, like I said, at least 8 classes a year and be able to serve, anywhere from 30 to 50 people a year. So our goal for that is just to continue to grow that relationship and continue to expand our health promotion services out there. And then our Title III goal for our National Family Caregivers. One thing that came up in all of our outreach was that there's not enough services for individuals in our community for caregiver services. There's not enough caregivers out there, so how can we look outside of the box and what can we do to help support families and individuals in our community? And some counties have what's called a friendly caller service. So that is our plan for the next 3 years, is to work on developing a friendly caller service. So that way, if we have people that are homebound or people that are needing services, but there's not a service out there, we can call them, we can check in on them. So we will be looking at creating a volunteer service to be able to provide friendly calls to individuals. So hopefully, just by having that interaction with people, because so many times what we find is that the only person that they talk to is maybe who's giving them a ride every week or who is delivering their meal every week. And families are busy, so it's just another person there to be able to provide them some support. So we are planning on starting a friendly caller service.
Madam Chair, Roxanne, have you talked any more about, you have elderly citizens at home about, it seems to me there's just a very small list of people who will come in and help their houses clean. So was that discussed at all when you were looking at your goals?
So it was. So when we did our survey and we did our outreach, a lot of people, when we talked about it, so I went through and tabulated all of the responses. The biggest thing was that somebody would just call me. It was the biggest need, if I just had somebody to talk to. And, people get very lonely. And so I think part of that social isolation is just not having somebody to talk to. And that really does then affect their ability to do other things as well. So we actually, Larry Engel is on our committee as well. And because of the caregiver shortage, he would like to start a subcommittee to look at partnering with other agencies and other people in the community to look at the caregiver shortage as well. I think the one thing that I always have to remember is that we're a very small agency. We're a very small community, so we can't take everything on. So it is being a part of a work group to be able to try to find other options is something that's more appropriate. We don't want to try to take everything and do everything because then we wouldn't do it well. Yeah.
I'd like to ask about, does Schmitz Woodland Hills still have caregivers that go out, or has that been dissolved?
They don't do that anymore. They ended that service last year.
I know we're in a desert out there, and I am a former nurse, and I hear it, people would like to stay home, but their caregivers, the closest they could come from was La Crosse. And by the time you paid for them to leave La Crosse, come out here, do 45 minutes worth of work, and then go back, it's very expensive for families, and there just wasn't anything else available.
Right now, we have Lori Knapp Incorporated that provides services, but it's limited. We also have an individual driftless area, I can't remember, but she will provide services. And then we have, it's called Village Caregiving that comes out of Madison, but they hire people in the area. So those are the three agencies that come out, other than like Upland Hills and SSM Health, but that is more Medicare based and higher level of care. But for those individual caregivers where somebody just needs someone to come out and do some cleaning and some chore services, we have very few.
Thank you.
Yeah.
Special.
Yeah. So those are our goals. So the process now is, it was approved by our aging EDRC committee last week. It comes through us and then it'll go to the full county board, and then we do have to turn that into the state by November 8th. So yeah. And then the budget that is in here is on sure what page, if you scroll back through, it's part of the appendices. That is just a tentative budget because we don't actually get our budget numbers until March of next year, for next year. So,
This is an extremely informative report. Thank you.
Can I ask for one more question? You don't have that care even in Richland Center for going out and helping people?
so Lori Knapp is,
That's it, those three are all you have.
that's all that we have. Well, Bethel Home will do, but it won't do Richland Center. So Bethel services out of Viroqua. I take that back. They will go to like Boaz and Viola, but very rarely do we even get anybody up there because they just don't have the help to do it. But we do actually have an agreement with them as well. But there just isn't, and it's something that's happening across the state. There was a new one that reached out, but it would have been $75 an hour, and I said, we just can't. There's no way, we'd only get, $13,000 a year to support our caregivers, so we wouldn't be able to support very many people.
Okay, so what we need to do is approve the resolution, which includes that plan, but the resolution is 10B-24. Do I have a motion to approve that and send
I'll
that
make-
forward?
I'll make that motion.
All right, thank you, Ms. Kramer. Do I have a second?
Second there.
All right. Mary Miller. Any further discussion or comments? Not all those in favor, please say aye. Any opposed? Okay, thank you so much, Roxanne. Number 11, resolution relating to Richland County's participation in a state program providing specialized transportation assistance, which I believe is you again.
It is. So every year we apply for what's called the 8521 grant, and that is our specialized transportation grant that supports our driver escort program and our public transportation programs. So this is just a grant that we submit it, we get approved. So it's pretty simple. There's a lot of steps to it, but it's not too bad. So our budget is also included there. Nothing really has changed with our program. We utilize most of the funding for the driver escort program. We have a very robust transportation program. Most counties do not have a lot of drivers, but we have anywhere from 20 to 30 drivers, volunteer drivers at a time. So we provide a lot of trips every year, about 5,000 trips a year. So this grant does require a county match, which is $15,978. And then we get $79,889 to be able to support.
Make a motion to approve.
Thank you, Supervisor Kramer.
Second, yes.
Second by Braithwaite. Any further discussion?
I can't tell you how valuable this service is. I'm not able to avail myself, but I leaned on some buddies.
All right, all those in favor, please say aye.
Aye.
Any opposed? I have not received any correspondence from panels. Well, future agenda items, I was just looking back at my notes from last month. I mentioned the ARPA spending fund. Do you remember what we were thinking with that?
I think we're just gonna try to give that to you like quarterly. We'll probably do it, we can do it again next month.
Okay, I
November.
couldn't remember,
Just so that,
settled on.
so the ARPA spending plan, we could do it in November and December so that you guys are aware and then during that we are spending all that money.
Isn't it, we're done then by the end
We're
of
done.
December, right?
Yes,
Yeah.
we spend it all by December 31st.
How are we doing?
I think we're doing okay.
I think we saw it in like finance, an executive committee. I feel like it had come through what you guys had spent, but yeah.
Yep.
Anybody else have future agenda items, things that you received? Oh,
We
yes.
have 2025 contracts, revenue contracts, and that should be November or
Okay.
December county board.
Okay,
And then the opioid settlement funds, the grants have been made available, so they will be
Oh.
reviewed by this committee next month.
the grants. Do you mean people applying?
Yes.
Oh, yay. How many applications?
We haven't received any yet, but they're not due till November, early November.
Okay.
So, but we've heard rumblings that there's some coming.
Oh, good.
Yes. Yes, and then we have some lease agreements to approve.
Okay.
And then we will be bringing a request to purchase some agency computers. It'll be over the 10,000.
Okay. All right, so our meeting is November 7th. So, need a motion to adjourn to November 7th.
I'll make that one.
Have a second? Second by Supervisor Brewer. All those in favor, please say aye.
Aye.
Any opposed? Great, thank you guys, and thank you, everybody.
Have you gotten to Rockledge candidates?
Meeting, Madam Chair.
So is it did.
It was an old school,
It's an old
and it
school.
had been being utilized for meals, and the elderly
Yes.
like to get together and play
Yep.
games.
Okay.
But it was underutilized.
Yeah, and they rearranged, redid the room where we do the meals.
Yeah.
And